This is very
Hi.
exciting.
Hello, everyone. Thank you for tuning in to this Facebook Live chat on convalescent plasma and the Survivor Corps. My name is Claudia Cohn. I'm a medical doctor in the Twin Cities in Minnesota, and I'm also the Chief Medical Officer for the AABB, formerly known as the American Association of Blood Banks.
My name is Berrent, and I'm the founder of Survivor Corps. Survivor Corps is right now the largest, fastest growing grassroots movement in America with a forward-looking, solution-based approach to finding a cure and getting in every person who has been affected by COVID, empowering them to be part of the science, part of the solution by donating their blood, donating their plasma, participating in every clinical and scientific trial going on. And right now, today is actually our 1 month anniversary, and we hit 40,000 members this morning, which was very exciting. And so far, we are truly flooding these programs with volunteers. And so it's a pleasure to be here with Claudia to be able to answer some questions that we get a lot. And I know the answers to some of them, but I think that they'd be great to hear from the true expert. So I'm going to go through some questions that you all have submitted, and let's get started.
Okay, great.
Okay. I should also mention, if you haven't already, join our Survivor Corps group on Facebook. It's an open group, open to everybody, and our website is survivorcorps.com. And when you click on Get Involved, one of the buttons is powered by the AABB and will take you right to this incredible site where all you have to do to find the location closest to you that collects convalescent plasma is you put in your zip code, and within a however many mile distance, and you will find the facility that's closest to you. So I know that not everyone is lucky enough to live near a major research facility, but through our partnership with AABB, we are able to provide this opportunity to all Americans. And that's so important for all of us. Okay, let's get started. The first question is, what exactly is convalescent plasma? And can you tell me a little bit about how it's been used in the past?
Sure. So I'll begin with what plasma is. That is the liquid portion of blood, and it is where any antibody you've ever made in your life, which is part of your immune system, that's where they live. And convalescent plasma is plasma that is collected from someone who has already overcome a disease, in this case, COVID-19. And so your antibodies, your plasma is filled with antibodies against COVID-19. Convalescent plasma has been used for over a century to fight different diseases. It isn't the ultimate cure for disease. It's usually a stopgap measure that is used until a more specific cure can be developed. But in the case of COVID-19, it can help patients turn around who are in the hospital. So it's a very, very useful therapy.
And as far as I know, it's been used, starting in 1901 with diphtheria. The Nobel Prize was won back then for the development, and more recently with H1N1 and SARS and Ebola. So this isn't a novel approach, is that correct?
No, not a novel approach at all. It's been shown to be useful in many different diseases. And I'm glad you mentioned SARS and MERS, because those are both related to COVID-19, and convalescent plasma has been used successfully in both of those diseases. So we have some history here that gives us confidence that this will help patients.
Right. That's really important for people to understand, that this is not something that, someone just came up with a new idea, and that this has been a tried and true method. Next question was how many times can you donate plasma? For example, I can donate 8 times over 12 weeks, but is that standard across blood banks, or up to blood banks to create their own schedule?
That's a great question. So historically, the FDA says you can donate plasma once every 28 days. However, given the nature of this crisis, they have lightened or loosened the restrictions on when you can donate plasma, but every blood center across the country is making a decision about how often you can donate. Some places are saying you can donate as often as 4 times every 8 weeks. or once every 7 days. So I encourage you to contact your local blood center, the place where you think you'll be donating, and find out how often you can donate.
So it's really up to the blood bank itself to decide what
Yes.
their own rules are, even though the guidelines apply to everybody.
That is correct.
Okay. The next question we got was, I tested positive for COVID. Do I need a follow-up negative diagnostic test in order to donate?
So that's a great question also. The way the FDA has designed this, they say that if you have tested positive for COVID, you can donate within 14 days of being entirely asymptomatic. That is a little loosely defined, but if you're up
Although
and around,
I did see that the CDC revised their definition of symptoms
oh, did
in
they?
the last 24 hours.
Okay,
Which was interesting to see. I didn't get to see exactly what they were, but as we all know, it presents itself in so many different ways that symptoms is a hard term to define.
So in general, when I've spoken to some medical directors of blood centers, they say, if you're feeling okay, if you're up and around, count that as day 1. And then 14 days from then, you're allowed to donate, but only if you have between 14 days and 28 days after you've been feeling fine, you're going to need a second test to say that you are absolutely virus-free. It doesn't mean you're still infectious necessarily. It just means the test is to prove that you're virus-free. So between 14 and 28 days of being asymptomatic, you need that second test, and they will administer it at the blood center. If you wait 28 days, you can donate without getting that second test.
Oh, that's
I'd like to add a second little ripple, and that is a few blood centers have applied to the FDA for a waiver, and they are allowed to collect at 14 days without the second test. So once again, there's a lot of leeway how different blood centers are doing things, but I'd say that most are just simply waiting for 28 days after you're symptom-free.
One of the things that we've seen through Survivor Corps is, we see story after story after story of people going in at the exact 14-day mark, and almost all of them are still showing up positive for the virus. And again, we don't know whether or not that means that they're still contagious. So from just anecdotal experience, from what we've seen at the 21-day mark, people seem to be virus-free. And your antibodies build up in that time also, correct?
Yes, that's an important point. Your antibodies just keep getting higher and higher in level in your plasma until maybe about day 60. And then they start to plateau, and they'll stay high for an additional month at least. Now, everyone's different, and I'm just talking about the general experience with antibody levels. So if you wait 28 days, they should be higher in your blood than they were at 14 days.
So you're a better candidate all around.
Yes, yes.
Okay. The next question was, I got tested and had a positive COVID diagnosis, but nobody provided me with any kind of documentation. How do I donate without that documentation?
That is difficult. So that's a complicated answer. I'm going to start with, some centers are allowing you to come with a doctor's note. So once again, check with your local blood center to see if they allow that. Contact your hospital and see if you can get a copy of your positive test. If you absolutely cannot get a copy of your test, there is recourse, and that is, you can get an antibody titer test. That is the newest test that's available, and I'm just going to try and start from the beginning. The first test is a PCR test to show that you have the virus on board. You are currently ill, or you currently have the virus in your system.
Explain what a PCR test is for those of us who might not know.
That is, and yes, thank you. That is a test to show that viral RNA is present in your body.
So that you still have the virus in your system.
Yes. So the swab is the PCR test to which I allude, and that is to prove that you are currently infected with the virus.
Diagnostic test. Okay.
Diagnostic test. The second test that is just becoming available is the antibody test. And that is becoming more and more widely available each day. In Minnesota, we've just launched one where they're going to be able to test 20,000 people per day. That is proof that your your body has seen the virus, you have been infected, whether you knew it or not, you could have been asymptomatic, and you will develop antibodies. And so that is the second test you would seek if you do not have a copy of a test, the original test saying that you were positive for the virus.
Now, since we're talking about that antibody test, and there's been a lot of talk about antibodies, you're referring to the kind of test that refers to your titer level. And just to explain to those folks who might not be familiar with that term, the titer level, as far as I understand, and correct me if I'm wrong, is really the concentration of antibodies, how many antibodies you have, the antibody count.
That's
So
exactly right.
I donated through Columbia University, and I believe the threshold was 350 or 400. Beyond that, they didn't count. Once it got to that point, you're in and you're good. Now, there are a lot of tests being rolled out right now that are antibody tests that do not give the titer level. Will those tests also qualify?
I believe so, because a lot of these tests are what we call qualitative, which is a yes/no test.
Yes.
You have an antibody or don't you? That should be sufficient to qualify you, because the FDA has said, we want this titer level, but we understand that the tests aren't up and running yet. So what a lot of blood centers are doing is they're doing the qualitative test, yes/no antibodies. And if you're yes, they will store your tube and go back and check the level later as those tests become more available. So yes/no test should be sufficient as far as I know. But
okay. Well, we might have to revisit that soon.
we might have to revisit
have a follow-up conversation as these tests are rolled out, because we're getting more and more questions about those antibody tests and the differences between them. That's very interesting. The next question that we got was, and this is a great question to be able to ask. I'm desperate to donate, but I can't get an appointment anywhere.
Yeah.
Are the centers at capacity for receiving donations? And is there a movement to help increase that capacity?
Well, first, I'd like to say thank you for being desperate to donate, because we need those donations, and we ask you to be patient, because the word unprecedented has been used often to describe this whole phenomenon, COVID-19. And so blood centers have never had to face an onslaught like this so quickly, to collect a new product, to have so many people so motivated to donate that product. So please be patient. That's the first answer. The second answer is the AABB is working with blood centers across the country to try and help coordinate this entire effort. And we hope to make it so that it becomes easier. Everyone is working hard to try and make this easier for everyone. And so that's all I can say for now is please be patient and thank you, and keep trying.
Yeah, I will take some of the blame for that. Survivor Corps has been driving people to every blood bank in America and every convalescent plasma through research facilities in America. We have truly been mobilizing people throughout the country. And so I'm not going to apologize, because it is an embarrassment of riches. But to those of you who are waiting, people will get back to you. Just be a little patient as everyone gets accustomed to this new normal. But keep on trying. Don't give up. So we know that the next question is this. We know that some of the restrictions on donations regarding tattoos, sexuality, and international travel have been relaxed, but they're still being implemented at various blood centers. What is your plan to make sure they're adopting these new guidelines?
The AABB is very deeply involved with that, because we help blood centers. We provide tools for blood centers to make it easier for them to be compliant with the rules. Mm-hmm. And so if anyone has donated blood, there is a donor history questionnaire with lots and lots of questions to ensure the safety of the donor and the safety of the product for the patient. In order to follow these new rules, the AABB has suggested new questions so that we cover how the FDA wants things to be done, but the FDA needs to approve those new questions first. So we're in the process of getting FDA approval for how those questions are are posed at the blood centers. And as that becomes available, blood centers can then change their questions in their computer system and open things up. These things always take time, and I imagine that most people usually aren't aware of how much time these things take. So blood centers are moving as quickly as possible to implement the new rules so that as many people as possible can donate.
Because I mean, especially regarding, you know, sexual orientation, I mean, those rules were changed. And when I went to the New York Blood Center on Wednesday, the questions being asked did not reflect the changes in those rules at all.
Yeah, because things have to move through the FDA. They have to change their computer system. It's going to take a few months, unfortunately, before.
Really?
Yeah. These things are these computer systems are large and complicated. And not only do you have to make the change, you have to make sure that the change is done appropriately. You have to test it. So that's another thing that people have to be patient about, unfortunately.
Yeah, that is certainly frustrating for folks who do want to donate. And sort of a follow-up question to that is, if the blood is being screened anyway afterwards for various, you know, for any sort of pathogen, why is that restriction in place at all?
That's a great question. And that involves something called the window period. So let's just pretend it's HIV.
Right.
If you are HIV negative, but you have an encounter and you become infected, that first day of infection, if you go to donate blood, it's not, the tests aren't sensitive enough to pick up that infection. You need to wait, I believe it is 6 to 9 days before the test can pick up that infection in your body, that the HIV virus has to multiply enough so that the test can pick it up. So it is that window period. Every disease has a slightly different window period based on the test that we use. Okay. So that is why we always have to have the questions to try and screen people first.
Right. It's still, I mean, it still seems then that if a 3-month limitation going from a 12 months to a 3-month or 6-month, you know, whatever it is, if it's actually only a week, do you see further relaxations down the line?
No, not initially, at least. When it comes to, there are 2 industries where there's a no mistake allowed policy, and that's the airlines and blood. We are held to a very, very, very high standard, as we should be, for safety. After the HIV crisis in the 80s, everyone has decided to be very conservative about keeping blood as safe as possible. So that is why the testing is rigorous. The questions are also rigorous, and the periods of time may seem long, but it's just for everyone's safety.
Okay, well, hopefully the blood banks will catch up with the new guidelines.
Yes, they will
a little bit faster, because there are lots of folks who would like to be donating who are being turned away. So we've gotten a lot of questions about women and pregnancy, and can women who have been pregnant but haven't been pregnant for 6 weeks still donate? And I have 2 children, so I have been pregnant twice in the past, but not in 11 years. And it didn't get in the way of my donation, but we've heard from other members that they were turned away, or people are saying that women are not allowed to donate at all at some centers. We're getting all kinds of reports from different places. So can you talk to that a little bit?
Sure, I'll explain the theory first, and then I'll talk about individual blood centers. When you're pregnant, the fetus kicks a little bit, and a little bit of blood from the fetus enters the mother's bloodstream. The father's DNA is different than the mother's DNA, of course, and so the baby's DNA is different. And the mother can form what are called HLA antibodies against the things that are foreign to her system that her baby has from the father. Those HLA antibodies can live in your body for the rest of your life, which is true for all antibodies. And so it turns out that those antibodies, in certain fairly rare cases, can cause a disease or a problem called transfusion-related acute lung injury. We just call it TRALI. TRALI has unfortunately killed some patients. And so once it was discovered that it was these HLA antibodies, and it was realized that it was women who have had a lot of pregnancies have the most antibodies, that they were able to make this connection. They initially restricted women from donating any plasma whatsoever. Now what they'll do is, if you answer that you've been never pregnant, that satisfies them. But if you have been pregnant, most blood centers, or some blood centers, I should say, will then go on and do an extra test for whether you have these HLA antibodies or not. Some of us don't have them, even though we've had children. So that is the reason for that rule. And the reason why you're seeing different responses in different blood centers is because of what I've already mentioned. Every blood center runs itself a little differently.
Okay. How safe is it to donate blood if I haven't had COVID but would like to donate? I know that, obviously one of the main centers of, main focuses of these blood banks is not just convalescent plasma, but to also collect blood for the general population. What safety precautions are being implemented at blood centers to ensure my safety?
We're doing everything we possibly can at blood centers. For one, we are limiting the number of donors who are coming through the door, so only by appointment. So that will keep the flow of people controlled. They are trying to keep everyone spaced, 6 feet apart at least, social distancing rules. The machinery for the donations, each station is spaced apart so that you don't have to come in contact with people. They're wiping down the surfaces frequently with disinfectant. I say that it's safer than going to the store, because when you're in the store, you keep your social distance, but you don't know who you're next to, and you don't know whether the surface has just been cleaned. In a blood center, another measure that's being taken is they're taking the temperature of all donors and all employees, so that the risk that you have COVID on board is lower. So I think
although we also now know that there's a very high percentage of people who have COVID who did not present with a fever. My husband had COVID, he didn't have a fever.
Yes, I know. But every measure is being taken to try and ensure that you are as safe as you can possibly be. And I'd like to encourage people to please give regular donations now and beyond the COVID crisis, because we're always in a state in the United States where we're just on the edge of having a shortage, and we want to keep the tap open. We want to keep people donating as often as possible.
Of course, I know. We just need to make sure that people feel safe going to do it. So, we already covered the next one. You can skip that. If I donate directly through a blood bank, will I be told of the results?
No, probably not. I would say almost certainly not. It is a logistically difficult thing to do. So we don't want people, we want to discourage people from going to blood centers just to find out whether they've had COVID. That is not appropriate, and it's a poor use of resources. Blood centers take a lot of donations and have a lot of testing that they have to do, and have a lot of processes to keep segregating the different products. So it is a logistically difficult thing for them to then call every donor and tell them something about their status. So it shouldn't be an expectation that you can donate to find out information about your COVID status.
Will the blood banks then give you guidance on where to go get that antibody test?
Yes, I hope so. Again, every blood center is going to be different, but I imagine that many will try and have this information available. I can't guarantee it, but I think it's a good idea. And I think perhaps additional resources will be made available shortly, so that we will be able to connect people with the where testing is being done. But I don't know if that's available.
I mean, that would be a great direction to go in, as far as I'm concerned, because one of the big questions that we're hearing is, we keep on hearing about this antibody test, but where do I go to get it? So maybe we could use the blood centers to help circulate that information as it becomes updated. That would be a great tool for people who want to donate.
I quite agree.
So let's work together on that.
Okay, sounds good.
Okay. Since direct donations are now not being allowed, or should I say, let me ask that just as an independent question, and then we'll get to the rest of it. We're getting a lot of direct pleas on Survivor Corps of, my mother is on a ventilator and desperately needs plasma. She is O positive at X hospital that doesn't have a plasma program. We're looking for donors. And when I went to go donate the other day, I called the New York Blood Center. I said, can I direct my donation to one of these people? And I was told no, that we are no longer doing that. That was available 2 weeks ago, but it's not available today. So is that the case across the board, or was that just at the New York Blood Center? Are direct donations being allowed anywhere?
They are being allowed in some places that I've heard of. Once again, it's always a matter of logistics, whether blood centers feel that they have the personnel, the computer backup to be able to trace that unit for that person. It's a surprisingly complicated process.
Yeah.
So this is another thing where you should check with your local blood center. I would guess that most blood centers are not supporting directed donations because it can be very, very difficult.
So for those people, what is their best route? Their loved one is in desperate need of plasma. Their local hospital, the hospital that they're at doesn't have a convalescent plasma program. What route should they take? What is your recommendation for these people?
Donate as often as you are able to, as you are allowed to, as you are able to, and encourage as many people as possible in your circle to donate as well, because as more and more people join groups like Survivor Corps and others and can donate, every donation is a potential 3 units of plasma for people. So every donation could help 3 patients. And if you do the math, within a few weeks, maybe a month or 2, we should have enough convalescent plasma for everyone. So that is the best answer I can give, is just donate, donate, donate.
So I guess the corollary question to that is, the hospital has to have a relationship with its local blood bank, or is it through the Mayo Clinic? How is that working? And can you explain? So let's say, I'm at a hospital, my whoever it is, my loved one is in the hospital. I'm trying to get them plasma. They don't have a relationship with their local blood bank already. How do we encourage those relationships to be made so that we're not dealing with it on a crisis by crisis basis?
The FDA worked with the Mayo Clinic to develop this expanded access protocol, which is allowing hospitals to get convalescent plasma. And that is the route that most hospitals are now using.
Can you just break that down a little bit and explain that a little bit more?
Yes. So convalescent plasma is not a licensed blood product yet, which means that blood centers can't collect it and just give it to anyone, any doctor who orders it. It's considered an investigational drug. And any investigational drug must be obtained through a protocol. A hospital has to sign on to a program that says you're giving this plasma in a responsible way, and you are then collecting data to show that this drug is useful. So there are a few places, Columbia, New York Blood Center, others, that are doing really hardcore scientific protocols, and they're obtaining their convalescent plasma for those protocols. And those are collecting a lot of data, and they're very research intensive, and they're going to give us a great answer about how useful convalescent plasma is. This titer is needed for this sort of patient.
And analyzing the different types of antibodies as well, the neutralizing antibodies. And
Exactly. For everyone else who wants to get convalescent plasma for their patients, they can use the expanded access protocol. So Mayo wrote a protocol with the FDA where it's science light, I call it.
I like science light. That's my kind of science.
There still is science going on, but it is not as intense, and it is something that most every hospital is able to handle in terms of data collection. Over 1,000 hospitals have signed up for the expanded access protocol. So that means that over 1,000 hospitals can order blood from their local blood center, and that they should have convalescent plasma. As each local blood center is collecting convalescent plasma, the hospital can then get that convalescent plasma from that blood center. Does that?
I think so. So again, just to go back to the practicalities.
Mhm.
Your husband, your mother, whoever it is on a ventilator. You're trying to get the plasma. The hospital doesn't already have a relationship with the blood center. What do you do? Like what is your process?
If the hospital doesn't yet have a relationship,
Is that a difficult relationship to set up? Is that a
with the
lengthy
blood
process?
center, no, every hospital that has ever transfused a unit of blood should have a relationship with a blood center, because that's a given. That's how they
But it
get
might not be a blood center that is accepting convalescent plasma, or do they all?
that. I don't know. Most probably do, because they're highly aware of this issue, but possibly not all. I can't say. So every hospital that is complicated enough that it has ever transfused a unit of blood, which is probably most hospitals in America, will have some relationship with a blood center. And it's easy for a hospital to develop a relationship with a blood center. If the hospital has not signed on to the Mayo Protocol,
Mhm.
that's harder. That's harder because you need to have a relationship with a doctor who is willing to do that. It takes 5 minutes to sign up with the expanded access protocol.
Well, so that's a very good piece of information to know, that it only takes 5 minutes, so that it's something they know now what needs to be done, and it's not a very timely measure.
I'll give a plug for AABB at this point. If
Go ahead.
if the patients talk to the doctors and point the doctors toward the AABB website, which I should know by heart, but COVID, I'm sorry, I don't have it on the
You
tip of
get
my
there
tongue.
through Survivor Corps. Go to
Okay.
survivorcorps.com and it'll take you right there.
Yes. So if a doctor goes to the AABB website, there are links to the expanded access protocol, to the Mayo page, and it's very clearly laid out. It's very easy to use. It takes 5 minutes for a doctor to sign on and sign their hospital on. And once they're signed on, they then, if their hospital doesn't have a place where they are getting convalescent plasma, they can use the AABB tool to find a hospital or find a blood center that does. And it's extra work. Certainly it's extra work for that hospital, but they need to establish a relationship with a blood center that is releasing convalescent plasma. The Red Cross is a nationwide industry. A lot of blood centers are not Red Cross affiliated, but they also have nationwide contacts. So there should be availability of convalescent plasma at almost every blood center across the country.
So this is great information, because we're seeing so many of these requests, and and my heart breaks for these people who are desperate. And so that's really helpful to have sort of a roadmap for them to go down of how to make that happen. So those are all the questions. I was actually going to just spend a moment talking about my own experience of donating, since I've now done it 3 times.
Great.
And it was amazing. like I actually get giddy talking about it. It was truly been some of the most satisfying experiences of my life. And I will put, getting married and having children among them. I mean, who in a lifetime gets to save a single life, but potentially multiple in a 32-minute, completely painless procedure? And it was literally painless. I mean, I've done it 3 times in 3 weeks. You can see not a mark, not a bruise, nothing. It was 32 minutes, and there's this incredibly cool machine that sits next to you, and it separates out the plasma from the blood, and they put the blood right back into you. So it was just go in well hydrated, have a good meal before, the night before, and make sure you're drinking a lot of water for the 24 hours beforehand. And it is, it empowers every single person who has been affected by COVID the opportunity to be part of the solution. And that is such an empowering message, which is, I think, one of the reasons why Survivor Corps has been so successful. It's been one of these situations where if you build it, they will come, because there's such an innate desire to give back and to help and to be part of the solution. And this is the best way that you can help right now, the most critical way. And so I went, as I mentioned to you before we started, our official start time. I mentioned I was the first participant at Columbia University's convalescent plasma program. And I just saw yesterday that they had FDA approval for their trial on convalescent plasma, and you mentioned them earlier as well. And to read that and to think, oh my God, that's my plasma that they're using. I'm not a scientist. I'm not, I've sort of learned this stuff on the fly, but that I could have contributed in some way. And I've signed up for every trial that I qualify for. And have a standing appointment every 7 days at the New York Blood Center, and will continue to do so for as long as they allow. So I'm asked often, what is the recovery time? And the answer is none. I live on Long Island. I've chosen to go to the one in the city, even though there's one out here on Long Island. I've driven myself there and back. The last time I didn't even bother to grab the Oreos and juice on the way out. I forgot, and I just left and went on my way. It was beyond painless, but it was so emotionally, it was so gratifying. It was such a gratifying experience. We're in such a moment of collective crisis. And this is a way that allows each one of us, I mean, there's so many mysteries to this virus, but many of the answers lie in the blood of survivors. And so I encourage everyone else out there to pitch in, to do it. There's just no reason not to. If you have the power to be part of the solution, and we will give you all, we're a one-stop shop. Go to survivorcorps.com. Through there, you can get right to AABB. We link right there in the Get Involved section. We will give you every opportunity, all the updated information, answer your questions. And so you don't have to do your own research. We've done it for you. And just get out and start donating, and donate often, donate as much as possible. The world needs to come together and do this together, and we all need to do our part. And I can't recommend it enough. It is just an incredible experience. So
I think it is so great that there's this Survivor Corps. I'm very glad that you've hooked up with AABB, because it's a powerful partnership.
absolutely.
And all of you've been through COVID. That makes you strong. And you can then, if there's 20,000 of you, that means that there's 60,000 potential convalescent plasma units.
There are 40,000 members.
120,000 potential convalescent plasma units with just one visit. And you can make more than one visit if you can. And
I encourage that you do.
Help a lot of people. You'll be a hero. And how many of us can say that?
As we say all the time, be a superhero, save lives, get your cape on, get your cape ready, because every survivor has the capability of being a superhero. So thank you so much, Claudia. It's wonderful working with you, and I look forward to a long relationship ahead, but hopefully with COVID soon behind us, and we're just raising blood for regular things.
Absolutely, Diana. Thank you very much for hosting this, and thanks to all my AABB colleagues for helping out, and for everyone at Survivor Corps. Go donate. Thank you.
Bye-bye.
Bye-bye.